Welcome back, everyone. I'm super excited because I have my guest that's in here now, Jennifer Walker, and she's with Walker & Walker Healthcare Advisors. Welcome to the show. And I want you to tell everybody a little bit about yourself. We're live on Facebook, so hello to everybody out there. But I want you to tell everybody a little bit about yourself, what you do, and then we're going to kind of go narrow and deep today on some things that I think are really important for people to know about Medicare.
Sounds good. I am a Medicare broker, have been for the last 5 years, 5+. Before that, though, I spent almost 20 years in the health insurance industry alone. Claims department, everything from the people that did data entry that opened up your mail, to provider relations reps that worked correctly or directly with the doctor's offices, and the people that actually processed your claims. So those medical claim questions, I know a lot.
Yeah, a lot. I mean, this is what I think makes you so different, is that by you having that as your background, you're able to, all of the different codes and what they mean. And if something is wrong, you can help them check it by that.
Yes.
Right? There are things that, people have so many different questions when it comes to their bill.
Yes.
Where you can answer them.
And they don't realize how everything ties in together either. If there was an authorization that was required that didn't get obtained, or if there was an extra step that needed to be done. So like if it's a step therapy and they're not understanding how or why, or if sometimes they just needed additional information from the doctor's office, but you're getting this bill and you don't understand why. So we can take this time, walk through it, and I can definitely help you to understand what's going on.
Now, you work statewide, and this is no charge. This is a no charge service to the clients. And, people, they think that's too good to be true.
It's not too good to be true. I know the saying, like, nothing's for free, especially nowadays. This is one of those exceptions. So the idea is I'm really here to help you identify what's best going to work for you. And I'm one of those people, if once we talk, if you tell me don't call you, I'm not going to call you back if you don't want me to. This is not one of those, I'm sure we've all been there when you're on the internet, you click on something, now all of a sudden your phone rings and it won't stop ringing. Mm-hmm. I'm not one of those people, I'm a real life person. And I'm talking to you to help you. And if you don't need my help anymore, that's okay. You're not going to hurt my feelings, and I'll stop.
But I think the main thing is knowing that you have somebody who, first of all, the medical background that she has, I think that's wonderful, especially if you have a lot of different procedures that you've had.
Yes.
And you get all of these things in the mail. I mean, you're getting right and left hit with bills. You don't even know this is not a bill. It looks like a bill. I mean, it makes it very confusing. Her phone number is 602-750-0620. The website is Walker Healthcare Advisors with an E.com. Okay, you said that before you came on, there's some things that you really wanted to dive into.
Yes.
And one of them is the benefits of having a broker.
Yes. So us brokers have to get a license, and then we have to stay informed. So every single year, even once we have our license, we have to get recertified. And this is nothing that's small. Like, this is hours on end of reading, understanding, and testing, and having to pass at a very high percentage before you can move on to the next step. So that's the first piece. And then when you're a broker, you're contracted with just about every major carrier that's out there. You have to go to each individual carrier and then learn about their specific products and recertify with those. So there's a lot of time, effort put into understanding and really narrowing down what's going to work best and saving you the time from having to do so.
Right. And each one of those carriers change
every
year. Wow.
They can
That's
change.
You look
every
great.
Year.
Considering.
It can be a lot for sure. And if anybody has ever been on Medicare.gov, they can tell you it's overwhelming. from my previous life in the claims department, I've been on that website, and to put it nicely, it's not my favorite. It's not very user-friendly, and if you don't know exactly what to type in, then you get a little stuck. And unfortunately, things can be very vague, and so you're trying to get a very specific answer, and for reasons that are there, they light brush stroke it, and you don't really get the answer that you need. And that's where we come in, is we can really kind of get down to the nitty-gritty and explain to you exactly how things work.
So right now is a great time also to make a phone call, because number one, I always tell people, do not call people on the television. You know, so many people get sucked into that.
Yes.
Having somebody that can help you, let's say even now, you might be just turning 65 and having all sorts of questions. When to do that, when to make the call.
Yes.
And there are so many questions when it comes to that, and that is what you excel in, is being able to help those people. There's other people too, but especially right now, somebody's turning 65 every day.
Very, very true. And I recommend reaching out around that 3-month mark, not more than 6 months, because things do change. But I take the time, I have a presentation that I provide to you that is a Medicare 101. And it breaks down the nitty-gritty, like what is it, how do you even get started? Where do you go to get your red, white, and blue Medicare card? And what does it mean when you get it? And break down that card so you understand exactly how Medicare works for you. And I send it to you so you've got something to reference back, but we go over it together, and I answer all your questions so you know exactly what you're looking and getting into. There's so many people that I've met that have been on Medicare for years, and nobody took the time to explain it to them how it works, and they have no idea. They're just on something because that's what somebody told them to do, and they don't know why. And I explain the why.
I remember when my ex had a question, and we called and asked you, and it was like, let me check it out, let me see, and you get this answer from me that's not just throwing anything at you. You really explained it very well for me to be able to tell him, which is even harder for somebody to have to be able to do. Now, again, the phone number is 602-750-0620. It is a no-charge service to you. Walker Healthcare Advisors with an E.com. Coming back to the government website, and people who are getting inundated. I don't care what time of the year it is. I'm telling you right now, you get inundated, especially if they think you're turning 65, right, with mail and the television, right, and anywhere else. But it is very important that you get to somebody who's local.
Yes.
That is something that is also important. When you go with somebody that's local, because on television you call that person, they're not going to call you back. They're not going to talk to you like that.
You don't know where you're calling either. You think you're talking to somebody in Arizona, and if you're lucky, they're in New York.
Yeah.
So, and they don't know what the market is here. They don't know about the doctor's offices here. They don't know how things work. And it really helps you when you've got somebody that knows different nuances about your area.
And what makes her different is that your medical training and background in the, the administrative.
Yes.
That's more important than anything, I think.
It helps because I have it from all different aspects. I know how the insurance company works. I understand how the doctor's office works. And then you, as a beneficiary, the person that's actually needing to use those benefits, I understand where you're coming from too, so I can try to bring it all together for you.
It's a trifecta win with her. And the number to call is 602-750-0620. Again, I just think it's so important for people that are listening, especially for those that are turning 65. You have any questions when it comes to Medicare, give them a call and find out what they can do for you. Again, that number is 602-750-0620. We're going to go to a break because there's some other things that you want to talk about, people on supplement. There's also chronic illness that you want to talk about. And I'm telling you, there's a lot of people out there that are dealing with chronic illnesses that are going to want to listen to what you have to say. Because people with chronic illnesses are scared. right?
They're scared to make any changes because they don't want to break it. They think, okay, I finally got this set up, I just need to stop. Or because I've got this chronic illness, how am I going to afford everything?
That's big.
Yes.
That's really big. But being covered is probably the biggest thing. And right now, there's going to be some information that people who are dealing with chronic illnesses are going to want to tune in and listen. Keep on listening. The number again to call is 602-750-0620. Check her out. It's Walker Healthcare Advisors with an E.com. Hang tight. We'll be back in just a minute. Okay. We're doing okay?
Yeah, we're doing great.
So we're going to come back and just go back over here, circle back. And I want to also make sure I say this more than one time.
Gotcha.
Yeah.
Okay.
Okay. So let's see. Yeah. You see, with me, you don't have to do that much work.
This is why I knew it was fine when you told me. You're like,
Don't worry.
I'll be the safety. I was like, okay, you're right. Because you do. I just tell you what we want to talk about.
Yeah.
You lead me right on.
Right. What, for you, when you're working with people, I guess, well, if I ask you what's the biggest question that you get that most often?
The funny thing that people ask me a lot when they're new is, well, what's the best plan that's out there?
Yeah,
That is hands down, every single year that question comes up.
yeah,
And I have to explain to them, what works for me is not going to work for you. It really is individual, and it throws people off.
yeah.
You've gone your whole entire life where you're on a plan with other people. You got to think about your spouse. You got to think about your kids. And to hear that this Medicare plan is just for you throws people off.
I was out with some people the other night, and they were talking about that they have Plan F.
Okay?
And I was thinking, I didn't say anything because I didn't know whether that's still around or not.
It's around for people that turned 65 prior to January 1st of 2020.
Yeah, that must be, they're much older than me.
And so it's there. And anybody that, even if they're not on a Plan F, that now decides they want to be on it, as long as they turn 65 before, they can. It's anybody that turns 65 after that cannot. It's only available to those people. And then anybody after, the closest thing to it is Plan G.
There's even a Plan G. That's amazing.
There's so many different letters in the alphabet. You're like,
I don't know
what?
how you do it. Seriously, I don't know how you can
And
absorb all of that.
I try to send a cheat sheet for people that are on supplements, so they show all the different ones that are out there, because they'll think, oh, just the one that my agent told me about. No, there's others that are out there too.
Sure.
And I usually tell people the most common one and how it works, and then I'll say, but there are other ones out there too. And then I'll kind of give examples so they know how it works.
It's too much for me.
Get used to it after a little bit.
30.
Yeah, I would think so.
Yeah. But yeah, F, depending on what that premium is right now, they may want to consider something else. F, what it is, the difference between F and G as far as coverage-wise goes and cost sharing, F will pay for the annual deductible as well. G does not. You have to come out of pocket for it. But the difference in premium cost can be huge.
And I do think that people think that Medicare is free.
Yeah, they do.
So welcome back, everyone. We're still live on Facebook. So hello to everybody out there. We've been talking at the break. There's F, G, there's H. I can't believe what's out there. Too many letters in the Medicare soup, and it makes it very, very confusing for a lot of people. There's a lot of people today, they want to go up onto Google. They want to try and do it themselves. They go up, forget the website for the government website, because that's even harder.
It can be, and especially even with supplement plans, sometimes what they're quoting as the rate does not match, excuse me, what is on the actual carrier's website. So you want to make sure you have the most current information, and sometimes it's not updated as fast as it should have been.
Of course the government is not updated as fast as it should be. Now, people with supplements, what did you want to tell them about that before we go into chronic illness?
Anybody on a supplement plan, excuse me, sorry
Not
about
easy,
that.
folks.
Anybody on a supplement plan, the way that it works, the month that you got your plan is when they enforce that year's increase. And trust me, there's an increase every year. So because of that, and because everybody joins at different times, people turn 65 every day, as you mentioned, the rate that you have can change at different times for different people. And with the supplement plan, people think that, oh, I have to wait until annual enrollment to find out if there is another carrier out there that also has my plan, my letter of the alphabet, at a lower rate. You do not have to wait. You can call me now and we can look and see the other carriers that are out there and compare the costs. Underwriting, and for underwriting, just basically the questions that they're going to ask of you change carrier to carrier, and based off of that, their rates can be different. But anything, a plan G on one carrier handles and covers you the exact same way a plan G on another carrier does, but based off of their questions, the amount you pay, your rate, your premium can be different. And I can look at that for you and tell you, you're not going to get anything better than where you're at. Or, hey, there's a couple carriers out there that, based on how you answer the questions, you can get a lower rate and you still have the exact same coverage that you had today. You'll have it tomorrow and you're not paying as much out of pocket for it.
And you can call today to do that.
You can call today to do that.
Her
Yes,
phone
ma'am.
number is 602-750-0620. It's a no-charge service to you. It makes sense. Find out that really is true, because everybody is, right now, they're trying to save wherever they can.
Yes.
This is a place where you can find that out. Again, that number is 602-750-0620. Anything more on supplements?
That's the main thing. Just know that anytime you can find out if there's something else that's out there. You don't have to get away from supplements. You can stay on it and you can find yourself a lower rate.
I think that's great that you're coming on today to say that, because so many people are having such a hard time right now.
Yes.
And wherever you could save money, especially seniors, right?
Exactly.
Wherever you can save money. Again, that number to call her is 602-750-0620. Let's talk about chronic illness.
Yes, so chronic illness is out there. And the carriers, every year, they kind of work with Medicare on things. And they'll shift focus or they'll add something else in there. Before, there was a big focus on people that were on Medicaid as well. As you know, there's not nearly as many people on Medicaid as there were before. And so now the insurance companies are looking at, okay, for those people on Advantage plans, what do we have out there to really kind of entice them to come in? How can we help? And this year in 2026, they're really focusing on people who have chronic illnesses, diabetics, people that have cardiovascular diseases, things like that. They have these plans that are out there that are specific to you. And they'll make sure, a lot of times people with chronic illnesses, you know, you're going to the doctor more than the average person. And a $20, $30, $40 copay every single time can really start to add up.
Absolutely.
So these plans will make sure, depending on what your illness is, those kind of specialists, that copay amount will be a lot less. And they'll even potentially look at your prescriptions that you have, having them at a lower cost to you as well. And they'll throw in some extra things as well into those plans. And it really helps you based off of what your needs are. And the nice thing about that is, also, you don't have to wait. On Advantage plans, you're very specific to annual enrollment time. With these chronic plans, you do not have to wait. So you could definitely get diagnosed and make that change. You don't have to wait until the annual enrollment October 15th. You can make that change right now in July.
Oh, wow. Question, let's say somebody's had a chronic illness for a while.
Mhm.
Can they still call?
They can still call. So the idea is, if you're currently on a chronic plan, a chronic illness plan, or a CSNP is what they call it, chronic special needs plan, if you're currently on one, you cannot make a change if you're getting diagnosed with the same thing. If you're getting diagnosed with something different, then you can. But if you've had a chronic illness and you're on a standard Medicare Advantage plan, you can move to a chronic plan now, even though you've been diagnosed 2 years ago. There is eligibility and a requirement form that first you answer some questions, and then you have basically the first month that you've been on the plan for your doctor to verify. And as long as they get that the doctor verifies that yes, you've been diagnosed with that illness, they can move you and keep you on that plan.
Her number is 602-750-0620. You can call now. You can call today.
And it really does help. And if you question out there, hey, I've got this, but I don't know if it is one of those things that they recognize, call me and we'll talk about it. And I'll let you know, yes, there is this plan that's out there that'll work for you, or unfortunately, you'll have to wait until annual enrollment and then we can look at something else.
And annual enrollment is around the corner. Can you believe that we're talking about October already? Possibly.
We're blinking and it's gonna be here. In September, everybody that has an Advantage plan or everybody that's on a supplement that has a prescription drug plan, they have to send out that annual notice of change. That comes out in September. Everybody has to do it. And in there, it's going to tell you what your benefits are going to look like for the next year. And they try to keep it simple, even though there's a lot. It's almost a packet of information.
There's no way.
But you go back maybe 8 or 10 pages, and in the first column, they're gonna have this year's benefits, 2026, and then in the next column, it'll say 2027, and it'll show you how those are gonna be, but you're gonna blink, and it's gonna be time to plan for 2027.
But the good news is, number one, if you have a supplement, you can call now,
Yes.
right now, and you can see if they can find you a better plan, right, that can maybe help save you money. Anybody who has a chronic illness can also call
Yes.
right now as well. And again, that number to call is 602-750-0620. The website is Walker Healthcare Advisors with an E.com. I want to explain something. This is so interesting because a lot of people think, well, first of all, I don't think there's a lot of people that know that there's people like you that exist.
Mhm.
That's number one, which they do. Number two, they think that, we talked about this before too, that Medicare is free. They
Yes.
don't know, okay? They don't know that they can make these phone calls to you to be able to change.
Yes.
Right?
The first thing, you're right, people think Medicare is free, and the reality is you have been paying into Medicare all the time that you've been working.
Mm-hmm.
That Part A piece for the hospitalization is something because you've worked enough and paid enough into it, they don't charge anything extra. But the Part B, the medical piece, everything else, doctor's office visits, lab work, outpatient procedures, there is a premium to it. And it's funny you mentioned that. I had a client a couple weeks ago that says, my friend tells me she doesn't pay anything. And I was like, well, that's not quite true. If she's drawing Social Security, she probably forgot because they take it out before they deposit the rest in there.
Mm-hmm.
So just explaining, and so you know exactly where your money's going. And because of that, I talked to her about how important it was when she gets set up on her plan, how to get payment even set up so she doesn't forget. Because those are the scary truths too. Some
That's
people,
okay.
out of sight, out of mind, you don't think about it, you don't see it, so you just
You
keep
see
on
how
plugging
she
along.
is? That's awesome. You thought that Medicare was just, in October. It's all year round.
It's all
It's
year
all
round.
year round. It is a free service to you, and it makes sense, especially right now. You got a supplement, you can change. You're turning 65, you can call and find, she'll help you, walk you through it. You have a chronic illness right now, you can change. She's telling you that you can. She is a broker. She works for you to find the best plan for you. That's what it's all about, working with a broker, and how nice that is. Don't try and do it on your own, and call somebody local. That's what's important, having somebody here that can help you. That number is 602-750-0620. It's Walker Healthcare Advisors with an E.com.